Hello and welcome everyone. Myself Mijanur Rahaman, and today in this video we will discuss about the disorders of pituitary gland. In the previous videos we have already discussed about the pituitary gland and the normal physiology. Now we will discuss about the applied physiology part, that is the disorders of pituitary gland. So first of all, there are already all of us known to us that hyperactivity and hypoactivity are the main disorders of any gland. So, in case of anterobacterial, the hyperactivity disorders are gigantism, acromegalic gigantism, Cushing disease. And in case of hypoactivity, dwarfism, acromegaly, and Simon disease. In case of posterior pituitary, the hyperactivity causes SIDA, syndrome of inappropriate hypersecretion of ADH, and hypoactivity, diabetes insipidus. And anterobacterial and posterior both hyperactivity has nothing that much disorder, but in case of hyperactivity, dystrophia adipose genitalis. So now in today's video we will discuss only about the hyperactivity of anterior pituitary. So gigantism, first of all, gigantism is the pituitary disorder characterized by the excess growth of the body. The subject looks like the giants and average height is about of 7 to 8 feet. What are the cause of gigantism? Gigantism is due to the hypersecretion of growth hormone in childhood or in pre-adult life before the fusion of epiphysis of bone with shaft. And hypersecretion of growth hormone is because of tumor of acidophil cell in the anterior pituitary. Now, signs and symptoms. General overgrowth of the person leads to the development of a huge stature with a height of more than 7 or 8 feet. The limbs are disproportionately long and giants and hyperglycemic, and they develop glucosuria and pituitary diabetes. Hyperglycemia causes constant stimulation of beta cells of islets of Langerhans in the pancreas and release of insulin. However, the overactivity of beta cells of the Langerhans in the pancreas leads to degeneration of these cells and deficiency of insulin, and ultimately diabetes mellitus is developed. So how the diabetes mellitus is developed? Especially the patient are generally hyperglycemic and they develop glucosuria and pituitary diabetes. And in case of this patient, the beta cells is constantly getting stimulation for secretion more and more insulin. And overactivity of beta cells and of the Langerhans in the pancreas leads to degeneration of these cells and deficiency of insulin, and the occurs, and ultimately diabetes mellitus is developed. Now, tumor of the pituitary gland itself causes constant headache. Now, pituitary tumor also has visual disturbances. It compresses the lateral fibers of the optic chiasma, leading to biotemporal hemianopia. Now, second point, acromegaly. Acromegaly is a disorder characterized by the enlargement, thickening, and broadening of bones, particularly in the extremities of the body. Causes of Causes of acromegaly. Acromegaly is due to the hypersecretion of growth hormone in adults and after the fusion of epiphysis. If the growth hormone secretion is excessive in before fusion, it is gigantism. After fusion, it is acromegaly with shaft of the bone. Hypersecretion of growth hormone is because the tumor of the acidophil cells in the anterior pituitary. Signs and symptoms: acromegalic or gorilla face, with rough features such as protrusion or of supraorbital ridges, broadening of nose, thickening of lips, and wrinkling formation on forehead, and prognathism, prostration of lower jaw. So what happens? Signs and symptoms: acromegalic or gorilla face with rough features such as prostration and supraorbital ridges, broadening of nose, thickening of lips, thickening and wrinkling formation on the forehead, and prognathism, and prostration of lower head occurs. Enlargement of hands and feet, kyphosis, extreme curvature of upper back, and thickening of scalp. Scalp is also thrown into the folds or wrinkles like bulldog scalp. Overgrowth of body hair, enlargement of visceral organs such as lungs, thymus, heart, liver, and spleen, hyperactivity of thyroid, parathyroid, and adrenal gland, hyperglycemia and glucosuria resulting in diabetes mellitus, hypertension, headache, and visual disturbances, bitemporal hemianopia. Now, acromegaly gigantism. Acromegaly gigantism is a rare disorder with symptom of both gigantism and acromegaly. Hypersecretion of growth hormone in children before the fusion of epiphysis with shaft of the bone causes gigantism. If hypersecretion of the growth hormone is continued even after the fusion of epiphysis, the symptoms of acromegaly also appear. Now, Cushing's disease is also described in the Cushing syndrome video. You can also check that, but I will discuss a little bit. It is also a rare disease characterized by obesity. Causes are Cushing disease develops by basophilic adenoma of the adenohypophysis. It increases the secretion of adrenocorticotropic hormone, which in turn stimulates the adrenal cortex to release cortisol. Cushing disease also develops by hyperplasia or tumor of adrenal cortex. Usually, the disorder due to the pituitary cause is called Cushing disease, and when it is due to adrenal cause, it is called Cushing syndrome. This is already discussed in the Cushing syndrome video. You can check that. You can see the difference between acromegaly hand. A is normal hand and B is acromegaly hand. And in case of face, you can also see the gorilla face, protrusion, supraorbital ridges, broad nose, thickened lips, and protrusion of lower jaw. So this is for now. Thank you.